Hi, I'm Dr. Dan Cowie and I'm a GP, and today I'm here at Trinity Health Centre, Bridges Medical Practice, and we are going to run through a learning disability health check. Well, thanks for coming today, Doreen and Val. I'm Dan Cowie, I'm the GP who's in Trinity Health Centre today, and we were just going to run through your annual health check, if that's okay, Doreen?
Yeah.
And maybe I might ask you some questions and possibly ask Val to help me answer some answers.
Yeah.
Is that okay with you?
Yeah.
Okay, shall we get started?
Yeah.
Okay. Right. First of all, I'd just like to run through some past medical problems that you might have had. And I think Val will be able to give me...
I've got Val Hempsey, married to Hempsey because she died today. Rachel got baby boy given to
Right. So Val's one of the main carers for you, isn't she?
Yeah.
I'm your sister, aren't I?
Yeah.
Yeah.
Rachel married with Bob.
She's telling you all about our family.
Right.
Telling you all about our family.
Oh, the little baby who likes walking and things.
Yes.
Okay.
Yes.
So, a couple of things. So that's a bit about your family history. So this is Val and she's your main carer, is that right?
Yeah.
So who else is at home with you and things, Doreen?
All the time.
All the time?
Tell Dan about Irene. You've got Irene.
And my twin sister.
Oh,
Twin
so are you your twin sister?
Yeah.
Right. And how old are you, Doreen?
I mean, then I have Colin Option,
And
right?
she's married to Colin. That's our brother.
Colin.
Yes.
Colin, Mummy, Dad, kid, me.
Right. And does Colin live with you as well?
Yes.
Yeah.
Okay. And how old are you, Doreen?
Me. I'm 54.
54. So your Irene's 54 as well?
She is.
Yes.
That's all I have next September.
Right.
That's all I have.
In
Oh.
September she'll be 55.
Barry's 60. She's old.
Right. So you've got quite a big family?
Yes.
Okay. Right. And you've been in this practice for quite a long time, haven't you? So have you seen a lot of the other doctors in the practice and things?
Yeah.
So, and you don't mind
I
coming
do it all the time.
all the time?
I
Right.
can't go with Colin book. I have to call you.
Colours in when she comes, yes.
Right. Right.
I've got this good book. I've got last week. I've got that book before Christmas.
So you can do some colouring in and things?
Yes.
Excellent. Well, do you mind if I ask you a few questions? Have you had any sort of cough, cold, flu-like symptoms over the last few weeks or been unwell?
She had to slim. She had to lose her
Never any time I've
she
got
had to lose her belly.
Oh, so you have to be trying to lose a little bit of weight?
Yes.
Right. So how have you been managing with that? Has that been all right?
Yeah.
And then you eat better, don't you?
Yeah.
You eat properly.
Right. Well, we might check your weight a little bit later. Is that okay?
Yeah. No problem.
Okay. And have you been doing a little bit of exercise over the last few months as well? What sort of things?
We've carried Dana because we've got a great shield back.
Right.
She goes on a Thursday to a gym and does exercises.
Excellent. Are you enjoying that?
Because I have a bike.
With a
On
bike? Right. Do you do any swimming or any walking?
Sometimes.
Sometimes. Okay. And have you lost a little bit weight?
Yeah.
Excellent.
Yeah, she lost a little bit.
I'm doing a little bit of doing about.
Good. And what about your diet? Do you eat quite healthily? What do you normally eat?
I have salad.
Salads?
Never every time I have it all the time.
Right.
I can't keep sitting but I try to sleep.
And she tries to sleep, but she has the salads because Irene told her she has to eat the salads.
I
Right.
can't keep sitting, I can't get sleep.
No.
You can't get to sleep?
I can't get out of the yard.
Oh, what's the problem with your sleeping?
Yeah, it's warm, yeah.
It is a little bit warm, you're right. So you're having a few problems with sleeping?
What?
You're having a few problems with sleeping?
I find out.
You're fine now?
Yeah.
Okay.
Thanks.
So what's been the problem with sleeping?
She's sometimes she complains that she can't sleep and she can hear shouting, people shouting all the time, and she puts it down to when she was in respite, and she didn't like one of the ladies in there who shouted a lot.
Right.
So she doesn't like going there anymore, and she just likes to come to our sister's houses when she has to have respite.
Right.
But she can't sleep because she can hear the shouting.
But
we think that might be her ears.
Right.
I think she's got possibly a problem with
Come
her
on,
ears.
like you all the time.
Oh, we might have a little look in your ears later then if that's a bit of a problem.
Uh-huh.
Yeah. I'm looking over.
Okay.
I know it's warm here.
It's warm, is it?
It is a bit warm, isn't it? What about if we could run through some medication? Because I know you're taking some tablets.
Take my own tablets.
You take your own tablets?
Yes.
And do you have them in a little box, or do you just have them on the...
I can put them in there.
She has pill dispensers, she has two.
That's what she said.
One's got Elvis Presley on and
Right.
one's got a cat on.
Oh, right.
Yeah.
So do you like Elvis Presley?
Sometimes.
Sometimes. So who gives the medication and things out?
Irene sorts your medication, doesn't
Yeah,
it?
she
Puts
was.
it into the boxes.
Right,
I got 2
But
cases.
then she takes them herself.
right.
She actually does take them herself.
Okay. And you're not having any problems with the medicines? Taking them okay?
Yeah, by now.
Yeah, takes them with some water, don't you?
Yeah.
And yet chewy, she takes a chewy tablet as well.
Right.
Once in the morning, once at night.
Okay, that's good. And do you ever forget to take them?
Sometimes.
Sometimes,
Yeah.
right.
That's sometimes because I forget to give
So
you
do
them,
most
don't I?
people, I'll tell you, so do most people forget to take them. So have we got any other problems at all? Anything that's been worrying over the last few weeks, the last few months? Because it's a while since we've seen you.
Well, she gets pain, which is why she takes paracetamol, but I think it's mainly in your knees, isn't it?
That's what she said, yeah.
Your
Right.
knees and your back.
So your knees have been a bit sore.
Yeah.
Right.
Can't dance the way you used
I
to.
can't dance quick and legs.
Right.
No, Tony put a wet brown tar, white stick, he put a ballet. Right?
Tony, who plays in the band in the
Oh,
Keeley
right,
band.
Yeah.
right.
So I've got my own drum. I have Tony.
And she used to play the drum in the Keeley band.
So
She
you-
can't do it anymore.
I've got
because
a black case.
she can't because she can't dance anymore.
Is that because of your knees?
Yeah.
Mhm.
So is the paracetamol helping then if it's
Yeah,
still
that's right.
painful?
No, I think it maybe sometimes needs a bit stronger, but
Something a bit stronger.
yeah, because she's had to stop all the dancing.
Right. And
No, I can't dance, can't get my drum.
would you like to start the dancing again?
I think you're ready.
She thinks you're right.
Oh, good. So apart
Sometimes.
from the pain in your knees, do you have any other pain anywhere else?
No problem.
No problem.
No problems. And do you have any problems going to the toilet?
Well, sometimes if
I
you
can't take away the glasses.
right, Doreen, you can go to the toilet fine, can't you?
Yeah, fine.
Yeah, she can go fine.
No
But
problems.
sometimes if she
Oh,
eats
yeah.
too much or drinks too much, then she gets a sore tummy, and she has to be careful that she doesn't
Right.
overeat.
Okay.
Give me a stop button.
But
And
she can go to the toilet fine.
Right. And I notice you've been rubbing your eyes quite a lot.
Ah,
Are they sore? Are they sore, or are they just watering?
it's okay.
They're all right, are they?
Yeah.
And do you get your eyes checked quite regular?
I know.
Okay.
Mm-hmm.
Any
Just
problems?
get new glasses, haven't you?
Yeah, can't just get it.
Any problems with hearing at all? Any problems with deafness or hearing?
She can hardly hear. She can't listen to the television anymore, can you? Can't hear the
Yeah,
telly.
that's right.
No, can't hear it, but we think that's why we think these voices are in. The shouting that you can hear,
Right.
we think
Yeah,
is possibly sore ears.
For the ears. So have we had the ears checked recently, or?
She's said that had them checked by the nurse, but she's going to see a consultant in June.
Right.
Yes, so hoping that that'll make it a bit better then.
Yeah.
But I think your eyesight's getting worse, isn't it? You can't see very well, can you?
No, fine.
It's getting better with your new glasses.
Yeah, can't get me out there.
That's good. Now, what we were thinking about doing, if you don't mind, I was going to have a little listen to your heart,
Right.
have a little listen to your lungs and things, that's your chest, and just have a little feel of your tummy and do your blood pressure.
Sometimes.
Is that all right?
Yeah.
Do you mind going on the bed to have a little examination? So you're nice and comfortable there.
Yeah.
I'm going to have a little look by looking at your hands to start with, all right?
Yeah.
So if you just show me your hands, that's great. Do you bite your nails?
No, it's all.
No.
I think she does.
Yeah, I think we'll just turn them over.
Never have that.
That's great. I'm just going to pop your hand down and I'm going to have a little feel of your pulse, all right? I'll just
Yeah.
feel down here.
That's right.
That's great. And can I have a little look in your eyes? Perfect. I'll have a little feel around here and a little feel of your neck, all right? Do you want to stick your tongue out for us? Perfect. Right, I'm going to have a little listen to your heart and things, all right?
Yeah.
So I'll just take my stethoscope, pop it in my ears, and all I need to do is I'll just pop this down here and let you just rest back, okay? Big breath in and out, and again, and out. Great. Can I just sit you forward a little bit, Doreen? I'm going to have a little listen at the back of your chest, all right? So I'll just lift this up a second, and you take some big breaths in and out for me. So big breath, and out, and again, and out. Big breath, and out, and again, and out. Perfect. I'm just going to rest you back a little bit, all right? So we'll just go back just about there. Is that comfortable?
Yeah.
Okay, just check that's secure. I'm going to have a little feel of your tummy, all right? So we'll just lift this up a little bit, and we'll just put this down a little bit. You just tell us if it's sore anywhere.
Okay, all right.
It's all right?
Yeah.
No pain around there?
That's all.
No pain there? That's great. We'll pop that down. Just a little listen. That's great. And all I want you to do is if you squeeze my hands for me, tight as you can. That's great. Perfect. And if you can put your arms up like that for me, I'm going to pull one forward, try and keep it where it is, okay? Try and keep your hand there. Perfect. So we'll keep pulling. Great. And we'll do the same again on this side. Pull back. There we go. That's great. Okay. Right. Could I just get you to spin your legs round, Doreen? We'll just put your legs round here.
And that one, yeah.
Yep. And this one as well. We'll put them both this side.
Yeah.
So we'll put this one over here as well.
Lift that one up and put round here.
Around
Oh,
there.
yeah.
There we go. All right, do you want to sit up for me? 1, 2, 3. So we're going to do your blood pressure.
Yeah.
All right. So, you all right? We'll just pop your hand in. Oh, you've done this before, I think, haven't you? So we'll just put that there. And what we'll have to do when we're doing our blood pressure is we'll have to keep quiet as we can, okay?
Yeah.
So I'm not going to speak to you.
No, it's okay.
All right?
No problem.
So you just relax. Perfect. That's absolutely perfect, all right?
No problem.
Yep. So, that is all finished with the examination. Absolutely fine, Val, all right?
Right.
So we might just run through some specific questions, if that's all right.
Yeah.
So, Doreen, I just need to ask you a couple of things specifically. Do you smoke at all?
Yes, okay.
No, do you smoke?
I don't smoke at all.
You don't
No,
smoke? Okay, I thought you didn't. That's good. And do you drink any alcohol at all?
Do you have beer
Do
sometimes?
you have some beer?
Wine.
Just the one.
Just wine.
Just wine.
Just wine. She likes a bottle of lager every now and again.
Every now and again.
Yes, I've got my own bottle.
But she has her own little bottles.
Ah, right.
But she's allowed two. She's allowed two at parties and
Right.
things, yes.
Okay.
Mm.
Okay. And a couple of other things is, you mentioned that your sleeping was a little bit of a problem before, wasn't it?
Yes,
Have you been sleeping okay recently over? You've been sleeping all right?
She actually does sleep very well, but she complains constantly about this shouting that she can hear. That keeps her awake. It doesn't really keep her awake because she goes to sleep, but she can hear these voices shouting at her.
Right. Okay. And I know you've got your tablets that you take.
Yeah, I can't got my own tablet.
But you haven't. You're not allergic to anything. You've never done.
I've got my own tablet. I take it every week.
Right.
Can't got my medicated.
Okay.
Can't got that one.
Okay. And there's no allergies to anything that we know of.
History of heart problems in the family.
Right.
A man died of a heart attack.
Right.
Yeah.
And our dad died of cancer.
Right.
And our brothers had a small stroke.
Right.
But other than that, we're not too bad. Family history of hyperlipidemia, all of it.
Right.
I'm trying to think. Blood pressure a bit, but she's quite fine. And our sisters all have osteoporosis.
Right.
But she doesn't.
Right. So.
She's had the DEXA scan.
And everything's all okay, isn't it?
Yeah.
From that side of things. And do we go to the hospital for any reasons? Do we see any specialists at all?
She's seeing the specialist at the minute, aren't you? Who's doing looking at some screening regarding the voices, and because she's getting a bit distressed about not sleeping. So she's having a few problems that way. So she's seeing a consultant, and she goes regularly for her breast screening, and she's going to have her ears checked shortly. But that's really all she goes for. She hasn't got any major physical problems.
Okay. And have we been getting our regular smear tests and things like that?
She's never ever had a smear.
Right. Okay. Okay.
But Irene, our twin, thinks it would be perhaps too much for her.
Yeah. Okay.
But she's okay. I mean, she's okay that way.
Okay.
Good. Okay.
Thanks for having me.
Oh, I'm here to help you. Is there any problems? You mentioned that you eat quite well and you've been on a bit of a diet.
Can't get that before Christmas.
What did you get before Christmas?
That book is square book.
Oh, cut there, you shot.
Yeah,
Colouring book. But I think
right.
some of it's about our diet.
Diet.
Different foods and things.
Okay, and there's no swallowing problems at all?
No, but if she's got no teeth left. She hasn't got any teeth, so she does gag if she eats too quickly.
Right.
If she eats too quickly or too, but that's really just down to her in some respects. If she eats slowly and she takes her time, and we're trying to make sure she has quite liquidy type foods. And
have we ever need to go to the dentist at all? Have we seen the dentist?
She's got
false teeth.
She doesn't like putting her teeth
in. Okay.
When they bone top, when the top,
right.
Take it out, look at you, crack up, white teeth.
Yeah, but uses mouthwash, don't you? Uses mouthwash every day.
Right, that's good. And I know you live with your sister and her husband. Do you go outside to any sort of clubs at all to meet people?
Yeah, you go to the hub, don't you? Go to the hub on certain days, and you work on a Wednesday. Where do you work on a Wednesday?
RPCA.
RSPCA.
Oh, really?
On a Wednesday.
Oh.
I'm downstairs. I'm upstairs.
She works upstairs.
You're upstairs,
and she sorts all the coat hangers out.
Yeah.
Right.
I try to remember the
She does all the numbers.
She remembers Debbie. She told me right away. Because I'm downstairs. I'm upstairs.
Right.
Debbie's the manager, and she works upstairs on the coat hangers.
Right. Yeah. And how long you been working there for?
Every Wednesday.
Every Wednesday?
Yeah.
Right.
For a long time now, haven't you? And she goes to that Men Cap Club. She goes to Men Cap Club as well.
Good.
And goes to Blackpool, and you go bowling, don't you?
Yeah.
Just goes exercising with bowling.
So you've got a busy time?
Yeah.
You're really busy?
You've got carried down there.
Yeah. But she likes to go and see the family as well, don't you? You go and stay at Pam's house sometimes.
Pam's.
And stays at Val's as well.
Val's. Right.
She likes to stay at our house.
Okay. Well, I think that's probably everything today. Is there any questions you've got for me? You want me to answer anything?
I've got Barry up and out, I've got Pam back now.
She's got Valerie and she's got Pam.
Right, that's good. At least you've got a big family around you, haven't you?
Yes,
Right.
I've got baby boy.
Okay.
And she loves Rachel, who Rachel's our niece, and Rachel's got Dylan John, and he's just started to walk.
Dylan who walks.
And she loves Dylan John. She loves
Right.
That's all she is.
Okay. Well,
she's going on holiday with him, aren't you?
Oh.
Yeah.
In an aeroplane. Yes.
Well, I think that's everything today. We haven't found any problems, so we do need to do this regular check every year to keep an eye on things. But obviously, you can come back sooner if there's any problems, and Val will help you do that and things.
That's right, yeah.
All right?
Yeah.
Okay.
She has her bloods taken regularly as well,
Right.
so she's had them taken as well.
Good. That's great.
Okay, so say thank you.
Thank you.
You're welcome. You're welcome. No problems. Oh, thank you. So today we've just completed our Learning Disabilities Annual Health Check, and it's vitally important that we actually carry out these health checks, because it's in the health check that we pick up a lot of the problems that people with learning disabilities may suffer from, and we can also prevent a lot of the long-term problems and difficulties that people and families struggle with. Anything from hearing to bowel problems, and also we can introduce things about social groups that you and yourselves and your family can get involved with. So it's vitally important that you come to primary care. You're certainly not a burden, and we welcome you to come here on a regular basis.